You're watching TVC News. Now let's bring you the updates on the news. World Immunization Week, celebrated in the last week of April, aims to highlight the collective action needed and to promote the use of vaccines to protect people of all ages against diseases. The World Health Organization works with countries across the globe to raise awareness of the value of vaccines and immunization and ensures that governments obtain the necessary guidance and technical support to implement high-quality immunization programs. The ultimate goal of World Immunization Week is for more people and their communities to be protected from vaccine-preventable diseases. So joining me now to shed more light about this week is Chief of Health, UNICEF Nigeria, Dr. Eduardo Celades. Now, it's good to have you join me, Eduardo.
Thank you. Thank you very much for inviting me today in this relevant week.
All right. Now, the point there is, it is on record, the report had it about 23 million children missed out of their regular vaccination in the year 2020. What implication will this have on the process going forward?
That's correct. We have globally 23 million children with 0 dose of vaccines, and about 10% of them, they are here in Nigeria. More than 2.5 million children are not vaccinated here in Nigeria. We know that vaccines work. We know that vaccines save lives. We know that vaccines are the best way to show love, care, gratitude to our children, to our communities, to our family, to our friends. And when we have so many children not vaccinated, this is a clear risk for outbreaks, as well as it has an impact in children's health outcomes and mortality. So this is an appeal to work, all of us, like partners like the UN, like UNICEF, government, Federal Ministry of Health, the MPHCDA and other agencies, and communities, etc., to work together to really reduce the number of zero-dose children and to really improve children's health outcomes here in Nigeria.
All right, when it comes to getting more children on board the immunization platform, what efforts are there to get more children vaccinated and immunized?
Yes, one of the big issues that we have here in Nigeria is the big inequities and the big difference on vaccination between different zones and areas. In Sokoto, for example, only 11% of the children are vaccinated. This is 1 out of 10. However, in other places of the country, like in the southeast, we have more than 90% of vaccination for BCG, for tuberculosis. So something that we are trying to do is to be more granular, more analytical, to really look to the data to see where these missed children, where the zero-dose children are, so we can really target our interventions. And we do two main things. One is to work with the communities and to work in social behavior change and demand creation. We really need to ensure that all of us will promote vaccines, not only the convinced, but we talk with our families, with our communities, with our friends on the importance of showing love for our children. So to get people vaccinate their children. So we are working with traditional leaders, with religious leaders to really create this demand of the vaccines. The other thing that we are doing is to really support the logistics to ensure that the vaccines that normally they are called, they arrive to the more remote communities. So we are supporting teams with transport, with fuel, with everything that they need, so they can go to the remote areas, the insecure areas in the northwest or in the northeast, to the urban slums in Lagos, wherever is needed, to really reach the last children and to reach the most vulnerable and not leaving one behind.
All right. Now, in all of this effort that you're putting together to ensure that children get immunized, what support are you getting from governments, either the federal or the states or even local governments, in ensuring that there's success and concerted effort towards this?
This is a joint effort. So we as UN agencies and UNICEF, we provide technical support. We provide, of course, financial support as well. But at the end is the frontline workers, is the doctors, the nurses, the midwives, the ones that they are there vaccinating children. And they are from the state governments and from the Federal Ministry of Health. So what we are doing together is to try to strengthen the primary healthcare system. So to have a strong system that they can really deliver the services. But as well, we're not only working with government, but we are working a lot with the communities. We have an amazing network of more than 14,000 women living at community level, that they are helping us to vaccinate. And we had a huge success. If you remember, 2 years ago, we eradicated polio from Nigeria, right? So we know that vaccines work. We know that we can work with the communities and with the government, and we can achieve results. But still, we have so much to do. I mean, only 57% of the children here in Nigeria are vaccinated against Penta 3. This is our best indicator for vaccination. So we still have a lot to do. 3 out of 10 children are not vaccinated at all. So we really need to intensify our efforts if we really want to succeed in the next few months.
All right. There used to be initial resistance to the idea of bringing out of families, letting their children out for vaccination. What is the disposition now? Do you have more people agreeing to be vaccinated and more families and mothers agreeing their children to be vaccinated?
You know, the vaccination world is getting very complex. Now, for example, we have the COVID-19 vaccines, right? And there is a big movement of anti-vax and others and vaccine hesitance, etc. I think we need to come back to the basics. Vaccines were invented 200 years ago. We have vaccines for 25 diseases. Only in Nigeria here, we have vaccines for 14 antigens of vaccines. And we know that they work, right? So we really need to mobilize these side supporters. All of us, we vaccinate our children, right? But we don't promote it actively. It's something that we do at home and we just do it. But I think it's very important that we talk with our neighbors, with our communities, with our friends, with our families, and we really show how we care about others. Vaccinating is the best thing that you can do for the next generation. It's a way of showing gratitude to the health workers that they are in your community. It's the best way of showing respect to your neighbors. If you are protected, all of us, we are protected, right? So really, I think we need to move to being like silent supporters. It's okay, yeah, we vaccinate our children, to really talk to others and to really say, look, this is important. This is a way of showing love. So let's do it together. And I think that's the missing link that is still missing there.
All right, Dr. Eduardo Celades, Chief of Health, UNICEF Nigeria. Thank you very much for talking to us.
Thank you very much for inviting me here today.
Great. Moving.